Welcome to the Saúde da Próstata channel. If you're new here, this is your space to learn everything about men's health, especially when it comes to protecting your prostate, improving bladder control, and enhancing your quality of life. If you're curious about how to stop urine leakage, improve your performance in bed, or recover better after prostate surgery, you're in the right place. I'm talking about Kegel exercises. That's right, these simple, controlled muscle contractions can make a powerful difference in your life. Whether you're dealing with sexual dysfunction, urinary problems, or just want to improve your pelvic health, this video will show you how to get started, what science says about it, and how to avoid the common mistakes. So, take a second to like this video, subscribe to the channel, and share it with someone you care about. In 2005, researchers conducted a randomized controlled trial involving 55 men suffering from erectile dysfunction. It found that pelvic floor training helped men improve both erectile dysfunction and premature ejaculation. In fact, one study showed that 55% of men with premature ejaculation completely resolved the problem. In another trial, ejaculation time increased from just under 40 seconds to nearly 2.5 minutes. If you experience erectile dysfunction, premature ejaculation, urinary leakage, post-surgical incontinence, or just want better pelvic control, Kegels are for you. That's your pelvic floor. Or imagine you're trying to hold in gas. Same muscle group. Another visualization that works well is imagining walking into freezing cold water when your genitals naturally pull upward into your body. That reflex, that's your pelvic floor activating. That's 30 short contractions a day. At first, don't try to hold them for long. Think of it like flicking a light switch in, off. Once you feel more confident, you can increase the hold time to 3 seconds, then 5, eventually working your way up to 10 seconds. But if you have chronic pelvic pain during ejaculation, frequent urination, constipation, or pain in the pelvic area, you might be suffering from a condition called pelvic floor dysfunction. One option is stop the flow of urine. Another is lift your nuts to your guts. You don't need any equipment. You don't need a gym. Just a few minutes of focused attention every day. Flick on, flick off, and don't skip days. Like any fitness routine, the key is repetition. Over time, you'll feel stronger, more in control, and more confident. Yes, it sounds funny, but it's a mental cue that works. You can also visualize lifting your penis off a table without touching it. Drop your questions or your progress in the comments below. We'd love to hear from you and support your journey. Whatever works to help you isolate and engage the right muscles is valid. This area is called the perineum. When you contract your pelvic floor, you should feel a tightening or lifting movement under your fingers. Sit at the edge of a chair with your feet flat on the floor and your genitals free. Place your 2 fingers gently on your perineum. Breathe in slowly through your nose. As you breathe out through your mouth, imagine stopping the flow of urine or lifting your genitals up. Hold the contraction for 1 second, then relax completely. That's 1 repetition. If you do, you're on the right track. In that case, doing Kegels without medical supervision could make symptoms worse. Always check with your doctor before starting if you're unsure. That's a big difference, and it came from consistent practice of simple exercises. Isolate the pelvic floor muscles only. Also, don't hold your breath, breathe naturally, and stay relaxed. Start lying down. If it helps, then progress to sitting and eventually standing. The more positions you practice in, the more functional strength you'll gain. One group received pelvic floor exercises combined with biofeedback, a technique that uses sensors to track the strength of your contractions. Many men don't even realize they have a pelvic floor until they begin training it. Be patient. Just like going to the gym, it takes time to build muscle awareness and strength. Some men feel results in a few weeks. For others, it might take a few months. The important thing is consistency. Many men experience involuntary urine leakage during everyday activities like sneezing, coughing, or lifting something heavy. Multiple studies have confirmed that those who do Kegels after surgery reduce their leakage over time, and those who work with a pelvic floor therapist get the best results. It's like going to the gym. LLC, better results with a coach than going solo. The other group was only given lifestyle advice. After just 3 months, the group doing the exercises showed significantly greater improvement in erectile function. That's because these muscles contract during climax. So the stronger they are, the more powerful and satisfying the sensation may be. By 6 months, 40% had regained normal erection. They also experienced less post-urination leakage. It's free, and it helps us reach more men who can benefit from this vital information. Today, we're going to talk about a topic that many men have either never heard of or think it's just for women. Picture a hammock of muscle stretching from your tailbone to your pubic bone. This muscle group holds up your bladder, supports your prostate and rectum, and plays a vital role in everything from urination to bowel movements to sexual performance. In fact, more and more urologists and pelvic specialists recommend them for men who want to avoid medications or recover from surgery more quickly. One key muscle in that group is called the pubicochaetus muscle, or PC muscle. First things first, what exactly are Kegel exercises? These exercises target a group of muscles known as the pelvic floor. That's where Kegel exercises come in. They help restore strength and coordination to those muscles. When these muscles weaken, often due to aging, prostate surgery, being overweight, or even chronic constipation, men may begin to experience urinary leakage, post-void dribbling, premature ejaculation, or erectile dysfunction. Although Kegel exercises were first developed in 1948 by Dr. Arnold Kegel for women recovering from childbirth, they have proven to be incredibly effective for men too. Let's take a look at the science. Another piece of evidence comes from a 2019 systematic review of 10 clinical studies. Kegel exercises also play an important role after a prostatectomy, which is the surgical removal of the prostate. Now, one benefit of Kegels that's not as well studied but commonly reported is improved orgasm intensity. Now let's talk about who can benefit the most from these exercises. Now let's walk through how to find and activate these muscles. Imagine you're trying to stop urination midstream. That muscle you're contracting, to confirm that you're doing it correctly, place 2 fingers under the scrotum, on the soft skin between the genitals and the anus. Now, here's a simple routine to start with. Start with 10 repetitions in the morning, 10 in the afternoon, and 10 before bed. Make sure you don't clench your buttocks, abs, or thighs while doing these exercises. Now, don't worry if you don't feel a strong contraction at first. And here's a bonus tip: choose a phrase that helps you activate the right muscle. So, what's the bottom line? Kegel exercises are a low-cost, science-backed, side-effect-free way to improve urinary control, sexual function, and recovery after surgery. Start with 30 reps a day, 10 in the morning, 10 in the afternoon, and 10 in the evening. Thank you for being here with us on Saúde da Próstata. Your health matters, and you deserve to feel good in your body. Again, if you found this video helpful, please click the like button, subscribe to the channel, and share it with someone who could benefit. Take care of yourself, because you're worth it. See you in the next video.